Great. So, hi everyone. My name is Nikita. I'm here today. I've been asked to give you like a short, basic human anatomy lecture just to sort of give you an insight into what medicine as a degree would be like. Um, Before we get into it, just a little bit about me. So, for the first 10 years of my life, I was in India, and for the next 10 years and onwards, I've been in Malaysia. I did my IGCSEs and my A levels there. And afterwards, right after, I applied to loads of medical schools all over the world. Ultimately, I chose University of Bristol. I just gave my second year final exams in June, and I did well. So now I'm going into third year. Um, Now about the lecture, just some things to keep in mind before we get into it is that anatomy in itself is a 3-year degree, and there is a lot to go over that I can't possibly do that in an hour. But what I have done is taken some bits and pieces which I think would give you some insight into what anatomy in med school would be like, as well as just some basic things you can, if you're eager and keen, you can get into it right away and you can start learning now itself. I've also shared some tips and tricks, some acronyms and mnemonics that will help you remember some things. Um, it is okay if you find it a bit too heavy, this lecture, or if it's too overwhelming. It's meant to be because these are things that they will teach you over the span of a term at least. So it would be helpful if you have a paper and a pen beside you to just note down things you find difficult or things to come back later on, and or maybe refer to once you actually start med school. All up to you. My duty today is just to let you know some of the basics, so you have some idea. And that's it. If you have any questions along the way, feel free to write it in the chat section. Literally anything. It's just a few of us here today. It's a great space to just ask whatever you want to, about medicine, about universities, about Bristol, UK, my life, my journey, anything you want to know. This is your time, and I'll answer it in the end during the Q&A section. And keep in mind, though, just a heads up that I have been at home for 5 months, haven't revised much as I should have. So if there's any anatomy related question that you want to ask, feel free. But if I don't know the answer, I'll just get back to you later through the C office or through Sumi. Yeah, great. So these are the contents that we'll be going through today. Your first lesson in anatomy, the absolute first thing they'll teach you the first time you go into the DR, the dissection room. Little bit of organs, bones, arteries and veins, nerves, and then that's it. Then there'll be a Q&A section. Like I said, there's a lot in each of these things to learn. So I've just taken out bits and pieces that I feel are, interesting and informative, and that you can sort of learn now itself without it being a bit too heavy. So here we go. First lesson of anatomy. The first thing you'll want to know is your anatomical position. This is the position that you will have your patients lie down in. Your cadavers will be in this position. When you do a physical examination, if someone's standing up, they'll have to be in the anatomical position, which is literally standing face forward, facing you, your feet, shoulders width apart. And this is the simplest diagram I could find on Google, but actually here, her hands are wrong. So her hands should be like palm facing you, and that would be the actual anatomical position. And then here are some of the terminologies that you'll need to know. So cranial is anything towards your head, towards your skull. Caudal is anything towards your feet. Anterior or ventral is anything in the front. Posterior and dorsal is anything behind. Then coming right here, you have your medial and lateral. So medial is anything that's on the inside or closer to the center of your body, and lateral is anything on the outside. You have your proximal and distal, something that you might have come across when you learn nephrons in O-level biology. So you have your proximal convoluted tubule, your distal convoluted tubule. So literally proximal means closer to the center of your body, while distal means away. So if I were to give an example for medial and lateral, it would be my nose is medial to my eye, and my ear is lateral to my eye because it's further away and my nose is towards the center. Same way, your shoulder is proximal to your fingers because they're closer, and your feet are distal to your knee because it's much more away. So hopefully that makes sense. Moving on, you have your planes. Your body planes, you'll have to know these very well because when you see the dissected specimens of cadavers in the lab, they will be dissected in different planes to give you different views. Also, if you've come across CT scans, MRI scans, they're in different planes as well because just depending on what the radiologist wants to see when they take you to a scan. So transverse or axial, which is AXIAL, axial, that's the plane which is horizontal. It gives you the cross section of the body. Coronal divides you into front and back, and it literally goes like slices right through. And sagittal would be anything that, like a plane dividing you into left and right. So that's the different sections that they'll cut the specimens in, that you look at scans in. So it's helpful to know what you're looking at, in a sense. So that's your body planes. Then you have these. I would suggest keeping me in the corner of your screens because I do tend to use gestures a lot to explain. It might be helpful, but if I'm obstructing your view, feel free to like just move me around. But yeah, so these are the movements that if you've ever gone to physical therapy, they use this a lot, like flex, extend, rotate. So some of the easy ones to, just which are very self-explanatory are elevation and depression. So you elevate your shoulders when you raise them, and when you put them back down, it's depression. Same thing here with your jaw. So when you jut your jaw out, it's protrusion. And when you bring it back in, you're retracting it. So that's retrusion. Same way with rotation as well. You rotate your shoulders, very self-explanatory. Here you have inversion and eversion, which is literally when you turn your feet inwards, inversion. When you move it outwards, eversion. So yeah, that's that. Then we come to flexion and extension. So flexion and extension, very commonly used, but it can be quite confusing to get. But literally, when you're flexing anything, you're bringing two parts of the body on either side of a joint together. So for example, when I do this, I'm bringing my arm closer to my shoulder, so that's a flexion. If I bring it back down, that's extension. Same way, what he's doing at the bottom here, he is raising his leg. He's raising it backwards, but he is bringing it closer to his hip, so that would be flexion as well. And when he brings it back down, that would be extension. So hopefully that makes sense. One more thing to cover here would be abduction and adduction. I still get confused over these because they sound so similar, but literally when you adduct, you're bringing anything closer to your body. And when you abduct, you're bringing it further away. And that's literally it. These are the terminologies that you'll have to know. Pronation and supination, that's a good one as well. Literally means when you're showing the back of your hand, that's pronating, pronation. And when you supinate, you're showing the palm of your hand. So no doctor actually tells their patient that, oh, can you please supinate your hand for me? Nobody says that, but anatomy is a language of its own, uses a lot of Latin and all that stuff. So it's just terminologies that you'll come across in textbooks and stuff as well. So it's good to know. And that's it. This is your absolute first lesson in anatomy. This is what they'll teach you before you get into the gory bit, the cool bit. And that's it. If you know this, you're already ahead of your peers. So I think this is good information to have, especially if you're already reading textbooks. You don't have to, I didn't. But if you're keen and eager and you are, then this, would help explain it a little better. And that's it. Moving on to organs. So it really does help if your medical school teaches you organs system by system. That's what Bristol does, but different medical schools teach in a different way. That's one of the things that you'll have to research when you're choosing to apply, like which med schools. But it helps because, as you know, like most organs, they system by system, they have a specific function, and their structure also depends on their function. So it helps when you learn it that way. Um, and these are the big ones that everybody knows: brain, lungs, heart, pancreas, stomach, kidney, bladder. Everybody knows these ones. But I just thought I'd highlight some of the structures that you may not know. So you have glands as well. You have salivary glands, yes, you may know that. But there's also types of salivary glands. You have your pineal, thyroid, adrenal. You have your gallbladder. You have your omentum, mesentery, spleen, thymus. So these are all that you'll cover in the future. I don't have enough time to, even though I'd love to, but I thought I'd just highlight the omentum. So if you know about it, it's great, but I didn't. So I was really, when I saw it, I was like, what is that? But so in TVs and movies, you're like in like gory movies like Saw and stuff, they always show you like, this character gets a cut across her abdomen and the intestines just spill out. And that wouldn't happen in real life because you have the omentum. So it's literally like a layer of tissue just covering all your abdominal organs, protecting it. It's like a tight vacuum seal, which just like packs all your abdominal organs inside. So it's like a protective layer and it's just there. And, it's good to know before going in that other things exist as well that most diagrams don't show you. I don't think most diagrams show you the omentum. It's usually the first one here. So it's, be prepared to learn about all these once you start med school. There's more to organs than what it seems as well. I thought I'd just highlight these things. So you have lobes, which you might not know. Your liver has 4 lobes, your right lung has 3, your left lung has 2. And, they have names as well. So I just thought that there's a lot to organs. It takes weeks to learn about each organ. But if you did want to get started, I think lobes would be a good idea because, like I said, they have different names and stuff as well. Your right lung has 3, your left lung has 2. Why? You might want to know. See, these are some things that, you can explore now itself if you want to get started. Positions in the body. So your right kidney is actually lower than your left kidney. And that's important to know as well. I ate 10 eggs at 12. That's a really good mnemonic that we always refer back to. I'll get back to it later because in a later slide because that'll be better. But yeah, that's it for organs that we're covering. And like I said, there's much more, much more that you'll cover later on. But if you did want to get started, I'd say this would be a good point. Moving on to bones. So we all know the skull, we know the ribs, the spinal column. Humerus is the bone, shoulder to elbow. Radius and ulnar are, your arm. And so your radius is this one here. So it's lateral to your ulna. And if anyone's been keeping up, I guess that would make sense. Radius is lateral to the ulna. Femur is your big thigh bone. Then you have fibula and tibia in your leg. And here, if you can see, it looks like the fibula is lateral to the tibia as well. So that's how, you use all these terminologies to describe these things. Again, there's much more to bones as well, clearly, because there's so much text here. They literally had to reduce the size of it to fit it all in. But I thought I'd take out the interesting bit. The first one is the spinal column. So really interesting. It's made of 33 vertebrae, and they all differ in size and shape depending on the position at which they are. So There are 7 cervical, which is in your neck region, 12 thoracic. Big surprise, they're 12 thoracic vertebrae because they're in the thoracic region, which is your thorax, which is your lungs, rib cage area. You have your 5 lumbar, 5 sacrum, and 4 coccyx. Something to keep in mind with sacrum and coccyx, they're actually fused. So here, if you see, they might look like it's just one big thing, which makes your tailbone actually, but they're actually not all of them are fused. There's actually 5 different vertebrae and 4 different coccyx vertebrae. Something to note down here would be the size. So you can tell that the lumbar vertebrae, which is this one, is much bigger, and the body is much bigger. And that's because as you go down, there's much more weight to support. So you have to have a bigger body and a denser body to be able to support that weight. There's also like holes in the center of each vertebrae, and these holes are in your vertebrae, they're also in your skull, and they're passageways for blood vessels and other things to pass through nerves. So here you can probably tell that your spinal cord passes through these foramen, and they're in the vertebrae, so they call vertebral foramen. Very, very intelligent. Yeah, they just came up with these. Spinous process, this is the part that you actually, if you feel your spine, you're actually feeling the spinous process. That's the part that juts out. So that's it. That's about the spine. And I thought I would put in ribs as well because it links with the spinal column. So you know how I said there's 12 thoracic vertebrae? You also have 12 pairs of ribs. And that's because each rib connects to the thoracic vertebrae behind. So you have 12 pairs of ribs, 12 thoracic vertebrae. And what people actually don't know is that there's categories of ribs as well. So rib 1 to 7 is actually called a true rib. So if you note down here, 1 to 7 like directly connect to the sternum, which is why they call true rib. 8 to 12 are called false ribs because they seem to indirectly connect to the sternum. And 11 and 12 are actually floating ribs. And that's because they're literally not connected to the sternum at all. They just connected to the vertebrae behind. So you can probably tell these two are very prone to fractures because they don't have the stability and the sturdiness as the other ones do. And yeah, that's what you need to know about the ribs. What I meant by the I ate 10 eggs at 12, so that's a mnemonic for, okay, so you know how the diaphragm is like a layer of tissue that just divides your thorax and your abdominal space. So it just divides everything and nothing goes through. Nothing goes through except 3 structures, which is your inferior vena cava, your esophagus, and your aorta. These 3 are the only structures that perforate the diaphragm and go into your abdominal space. And they love to ask you at what level they go through. So this mnemonic is a good one to remember because I ate, so IVC at T8, which would be around here, 10 eggs, so esophagus at T10, ooh, my mouse, okay, and then at 12, so aorta at T12. So those are the levels at which they go through the diaphragm. So that's an important one to remember because they love to ask you it, and hopefully it makes sense why. And yeah, that's it for ribs as well. I thought I would put this in. They don't actually pay that much attention to hand bones as much. For me, they just like brushed through it and that was it. But you are expected to know what each bone here is called. And the one that we were taught was some lovers try positions that they can't handle. And If that's a big culture shock for you, you're welcome to try the PG version, which is to save lives, the physician helps create treatments. I feel like this one's actually much better because this one goes clockwise, whereas the lover's position one, it goes like 2 to 5 and then 1 to 6. So I feel like the clockwise is much like easier to remember, and it just coincides with all the bones in there. So you've got your scaphoid, um, sorry, to save lives. So it starts with your trapezium and then your scaphoid, and then your lunate, your triquetral, your pisiform, hamate, capitate, and then your trapezoid. So those are the bones in your hand. And that's a quick mnemonic that you can literally just memorize now, be done with it, save time when you actually start med school. Okay, now we're on to arteries and veins. I think we're already about halfway through. This one, I would say that there's quite a lot of names coming up, but don't feel overwhelmed because it's okay if you don't remember them all now. It's okay if you find it a bit difficult to understand. As time goes on, you'll see it more and more often. So you just unwillingly, you just memorize it. What I would say though is that these ground rules would be helpful to remember. The first one is that there's more veins than arteries. And some blood vessels can be superficial, which is closer to the skin, and some can be deeper inside. Usually you would just see superficial veins. There's not many arteries that are superficial, and that's because if an artery was closer to your skin and you just like sort of bump your hand across, then literally your artery would burst open and you would lose so much blood. So that's why they have to be deeper inside and protected, and to be able to perfuse the tissues as well. But your veins, there'll be superficial ones, there'll be deeper ones. So the ones that you see all over your skin, they're actually the superficial veins. And then this might sound silly, but I tend to forget sometimes that the left side is actually the same as the right side. So they tend to teach you just one side, and then you end up thinking, oh, what's going on the other side? But it's literally the same. It's all divided. And another rule that would help you remember is that name changes every time there's a branch. So it would help if you remember blood vessels as roads if you drive, or like a river and its tributaries. So literally anytime there's a turn or a branch, the name changes. Also, anytime you're in a different location, the name changes. So for example, you could have a blood vessel here, it could be called something, but here it could be called something else because it's at a different spot. It's near the shoulder. So hopefully that will help. And I know it can be quite complicated, and I couldn't find like simpler pictures online. So I thought I'd simplify it by drawing it out. No judgment, please. I know I'm not that good at drawing, but hopefully this will make sense more. These are the arteries that are the main ones, the absolute main ones. You will come across it loads of times. There are many more branches, but if you know these, I'd say you're good for at least a few terms, like semesters. So I can go through these with you. So let's say this is your very artistic heart. And then you have one, which would be your ascending aorta. So as we know, arteries, they take blood from the heart, pass it around the body, and then they go away from the heart. So you've got the aorta that comes out from here, and it actually loops down and then just goes down. So what you have here is your aorta that loops around, but at this point, there's branches off of it. So before it turns, there's a few branches coming off of it, which would be the brachiocephalic trunk right here at number 2. And then it branches again into your common carotid artery, and number 5, your subclavian artery. Rule of thumb, if anything has common in it, it means it's going to divide again, usually into internal or external, or deep and superficial, or great and small. So here you have your common carotid artery that becomes your internal carotid artery. This will go into your brain. And your external carotid artery, which goes to at the side of your temples. Coming back down here, your subclavian artery becomes the axillary artery. Big surprise, it's called axillary artery because it's at the axilla. Axilla is another name for your shoulder. So, you know, most of these names are quite self-explanatory, so you won't have to worry that much about memorizing them. You have your brachial artery right here. Some of you might know this is an important one because this is the one you look at when you measure somebody's blood pressure. So brachial artery is the one you listen to. And then you have your radial artery going at the radius. This is the one you measure the pulse at when you do this thing, when you do this doctory thing, you measure your pulse here. And then 9 is your ulnar artery. Great, that's your upper limbs done. When your aorta comes back down, it's called a descending artery because it's going down. And then you have your common iliac artery. So since it's common, that means there's going to be an internal iliac artery. This is the one that supplies your reproductive organs. And then you have your external iliac artery. Your external iliac artery then becomes common femoral artery because now it's going into the femur, which again divides into deep and superficial femoral artery right here. This spot is supposed to be your knee. I apologize, my drawing skills are so bad, I drew it at the thigh, but this is supposed to be your knee, and that's your popliteal artery, which further divides into anterior and posterior tibial artery, literally in the front and the back of your tibia. So anterior and posterior tibial artery. Very simple. If you find it a bit difficult to grasp right now, it's completely all right. I'm literally bombarding you with information right now. So, you know, take your time. This is being recorded. You can come back to it, pause, and, you know, take your time with it. These are your veins. So like I said, there's like more veins than arteries. And more or less, they're very similar to the arteries, similar names. There's just a few differences. So for example, here you have your heart, you have your superior vena cava, and going down here is your inferior vena cava. So your superior, again, becomes your brachiocephalic trunk, which further divides, and this time you don't have a common jugular vein. Like here you had a common carotid artery. You don't have a common jugular vein. Instead, it just divides individually into internal and external jugular vein. Again, jugular veins are the ones you see on your neck here. Great. Then you have your subclavian vein right here, and then your axillary vein. Here again, there's a couple different branches. So here you have your cephalic vein, which goes down, 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 and this becomes number 11, your ulnar vein. Likewise, here you have number 7, basilic vein, which goes down and then becomes your radial vein. In the middle here, you have your brachial vein. And here, if you notice, again, this is supposed to be your elbow. But when it crosses right here at the crook of your elbow, if you guys recognize it, this is the one you take blood samples out of. Blood samples, blood tests, putting in IV fluids right here. That's your median cubital vein. And again, that's all your upper limbs. Like I said, same thing on the other side. Then you come down and then you have your inferior vena cava that become your, again, number 13, common iliac vein. And if you have a common, you have an internal and an external. Internal goes in here, external is right here, which becomes your common femoral vein. And since it's common, that means it's going to divide again. Great saphenous vein. If I'm not wrong, don't quote me on this, but if I'm not wrong, that's the longest vein in your body. Great saphenous vein. And then you have your deep and superficial femoral vein. And then you come down here at the knee, it's your popliteal vein, which divides into your small saphenous vein right here. And then your anterior and posterior tibial vein, just like your arteries. So in the front and back of your tibia. And that's it. These are the main ones that I think it would be beneficial for you to know. Again, you don't have to do anything right now. Don't feel too pressured. But if you were interested, this is a good place to start. Feel free to like write these down, take a picture or whatever you like. And that's it for veins. We're the last topic now. If you have any questions so far, don't hesitate to write it down. Nerves. So nerves, not many people know this, but there's actually categories of nerves. So you have your cranial nerves, which are all to do with your head and face. And then you have your spinal nerves, which just go and supply the body. So, innervate the body, supplies blood vessels. So yeah, luckily for you, I'm going to third year now, and so far nobody's asked me to memorize the names of spinal nerves. So unless you intercalate in anatomy or you, I don't know, want to become a surgeon, maybe then you'll have to know all these things, but I think you're good if you just memorize the cranial nerves for now. Very important, they'll always ask you their names, what they supply, is it sensory information, is it motor information? So here's a good one to remember. It's called ooh ooh ooh, to touch and feel very good velvet, such heaven. This is a great mnemonic to remember because I still struggle with memorizing these, but if you do this mnemonic, then you should be good to go. These are like, they coincide with the first letter of all these nerves, CN1 to CN12. Some of these names are actually very self-explanatory, so you shouldn't have to struggle too much. Like olfactory, with your nose, it has to do with your nose. Optic is your eye. And like I said, some nerves have sensory information to do with your senses, and some have to do with motor information. So for example, your optic nerve is sensory. So anything you see is, gauged by the optic nerve. But if you want to actually move your eye like up, down, left, right, that's your oculomotor nerve. So that's a separate nerve altogether. You have your trochlear, trigeminal, abducens, facial, supplies the facial parts of your body. And some of them actually have branches as well. But I think you don't have to like get into that yet. But the branches literally supply like different parts of your body. Your face. Glossopharyngeal. Again, glosso, your tongue, pharyngeal, pharynx. So it gives you an idea about where that nerve is. And yeah, this would be great if you just memorize it now. Honestly, it's going to save you so much time. To know sensory and motor information, here's one. So it's, some say my mother bought my brother some bad beer, my. So literally S is for sensory, M is for motor, B is for both. And that's how you can remember which nerve supplies has what information in it. So this is a good one as well. And that's it for cranial nerves. Literally all memorizing rather than anything else. That's why I feel like you could just do it now and save yourself some time later on. Spinal nerves. I think this is the last slide. So there's 31 pairs. You don't have to memorize their names, but it would be wise to know their categories, so to speak. You might recognize these numbers, which are similar to your spinal vertebrae. So there's 7 cervical vertebrae. You have 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, 5 sacral, and 1 coccygeal nerves. If anyone's been paying attention, they might have noticed, why is it 7 vertebrae, 7 cervical vertebrae, but 8 cervical nerves? And that's actually a good question if you had it, because let's say this is your spinal column, and each spinal nerve comes out of each vertebrae through those holes in each of them. But it always has to start somewhere. So this would be the top, and that's where your first cervical nerve would come out of. Then you just have your 12 thoracic, 5 lumbar, 5 sacral, only 1 coccygeal because it's so fused that there's only enough path for one of them to come out, which is why you have only one. Another thing I forgot to mention, actually, a really cool fact. Your first two cervical vertebrae are very special because they hold your neck, they hold your head up. And I think it's my favorite bone in the body. Really geeky, I know, but like it's my absolute favorite bone because C1, which is the first cervical vertebrae, has its own name, which is Atlas. And I was a huge Percy Jackson fan. I don't know if there's any Greek mythology fans, but Atlas was the guy who held the sky up, and so C1 holds your head up, which is just like I find it so cool. And you'll find these bits and pieces of like cool facts all over the body. It's really fun. It's like they take inspiration from loads of things, and the way they're named, some of them are really cool. So yeah, that's a cool fact. You might notice here this guy is colored very differently, and that's to show each region, each nerve supply innervates. So but this can be a bit difficult to just know because when I first came across it, I was like, how am I supposed to, remember this? Because it's so random and it does not make sense. Um, but I luckily found this really cool picture that just makes so much sense. And I wish they told me before, but now I'm going to do the right thing and tell you guys, which is this little thing. So don't worry about memorizing this right now. This will come way into the future, but it's really cool to know that this actually makes so much more sense when you put a human body the way it was ages ago. So each region that your nerve supplies is depicted really well in this picture instead of this one. So that's a helpful thing to know. Literally, you can just write it down for the future because you don't have to know this now, but when you do, think of me because I showed you this. Um, and that's it, actually. Hopefully, it wasn't too heavy or overwhelming. The whole point of this was just to, let you know what's coming up. And medicine itself, like every lecture, they will never explain to you anything in detail. They will always just tell you bits and pieces, and it's up to you to go back home and research more and learn how much you want to, because the information is so vast and there's so much. So I've given you some starting points. If you'd like to, you can research it more in your time. But yeah, we went over the anatomical position, planes, movements. Really good stuff to just get it down now. There's much more to organs than it seems, so do be prepared to study them in detail and come across more structures that you hadn't even thought of. There's a link between ribs and spinal column, so really helpful if you learn them together. We went over the main arteries and veins. It's okay if you don't remember all the names yet, just know the ground rules that I told you about. There's different types of nerves as well. Memorize them now if you've got the time and you're free and you're willing and curious, because you'll save so much time in the future and you won't have to worry about it when you're settling into first year of med school and you have to keep up with all these other subjects. So yeah, you can just do these now. I've been asked to put this page up because if you're interested in applying to Bristol, which is where I am, these are the grade requirements. If you're doing any other course, then feel free to just go on their website and there's much more there, and you'll be able to see it. This is the fee structure as of now, subject to change, but this is the latest one. And that's it. Again, if you have any questions, like Suni said, these are the contact details. If you have anything for me, you can ask now or ask to Sumi, and I will always get in touch with you through them as well. And yeah.
Thanks so much, Nikita. That was amazing. I've learned so much more about my insides, and I've learned like 100 new words. So thank you very much.
Hopefully it was good for everyone.
Well, now's the time for the participants to show their appreciation, or more importantly, ask questions. I might get the ball rolling because students ask me questions all the time that I don't always know the answer to. So Nikita, can you tell us a little bit about work opportunities in the UK for medics who are getting a UK degree?
Mm-hmm. Um, the work, honestly, the jobs here are great because so many of my friends do loads of part-time jobs. It can be a bit tricky to do it as a medic because you have more contact hours, but I still managed to do it. I did a telephone fundraising job, which was a uni job. Um, there's loads of uni jobs wherever, whichever university you'll go to. They pay really well, about almost about 9.5 to 10 an hour, which is really good money. And they're flexible with hours as well because they understand you're studying and your students. You can apply outside, you can do part-time, I don't know, cafe, restaurant jobs, or anywhere really. Um, I think you're allowed 20 hours maximum per
Right.
week, which is quite a lot actually. And if you have time, you can definitely apply to any jobs during your term time, holidays as well. Yeah.
And what about more related to medicine as an international student? Do you think it's quite possible to register as a doctor in the UK after you graduate?
I think so, yeah. I think one of the main reasons why people choose UK as well is because you are guaranteed a job here after you graduate. So once you graduate, you go through the same process as anyone else. You do your exams, they see your ranking, they see all these other things that you've done throughout med school, and then they rank you, and then they, depending on what place you've applied, um, you're likely to get in. It just depends on how strong your application is. But otherwise, you are an equal to everyone else, regardless of being international or local.
Great. Nikita, I don't know if you remember much from your times applying because you would have applied like around 3 years ago.
Yeah.
Remember what you put in your personal statements, and do you have any advice for personal statements?
Oh, personal statements. Personal statements, they can be very subjective, so it can be difficult to know what to include in. I'd say any experience you have, any work experience, it doesn't even matter if it's medicine related or not, put it in. Or any competition you've been in, just put it in because it does seem like they want to know, ooh, what operations you've seen and what doctors you've been around with. But ultimately, all they want to see is that if you have the dedication, time management skills, hardworking, all that stuff, so you can literally spin anything into something that they want to hear. So I said that I didn't really have much work experience, to be honest, because I know it's really hard to get work experience when you're just 16, 17 in Malaysia for me. Um, I just had 2 weeks of shadowing, which was literally just standing around, not doing anything. But I just put it in a way that, oh, I learned so much. I saw firsthand how doctors are, how they live their lives, and I just know I'm prepared to do medicine now. So literally, you can, if you spin it the right way, you can put all these things into your personal statement, and they see that a lot. Volunteering as well.
Yeah, and the University of Bristol is, we consider all kinds of work experiences, especially for students applying for 2021. If you've not been able to have much clinical or healthcare related work experience, one of our admissions tutors recently told me that they'll look at a student who's worked at McDonald's. They will look at all kinds of work experience, as long as, like Nikita said, you can link it to the kinds of skills and qualities medics also have. I'm just going to include a link to the info session that we ran a couple of weeks ago with the School of Medicine, that will give you some insights into what we're looking for medicine for 2021 applicants. So we've got some questions from students here.
Okay.
Nikita, is studying medicine all about studying every minute of the day? How is the study life balance?
I think the balance is as balanced as you make it. So the contact hours, yes, you'll have more contact hours than say law or geography or other courses. You will be having more lectures and tutorials, but really that's only until let's say 4 or 5 p.m. and that's usual uni hours anyway. So once you're back home, it's up to you if you want to spend an hour every day working and studying, or if you want to just have fun on the weekends and work on the weekdays, or vice versa. But I would say don't worry about your social life. You will have loads of time for social life. It's really great. I've done so much being here, and it's really how balanced you make it and how much effort you put into it. You can be the one who studies every day, every hour, and just memorize everything all the time, or you can be the one who strategizes well and studies at like when they have to properly, little every day, and yeah. So it's not too
And
bad, not to worry.
great. Another question. Do you think it's possible for an international student to apply for medicine with average grades, not all A's? Maybe I'll take this one. So from an admissions point of view, the university looks at predicted grades as the highest sort of indicator of how you've performed, especially for 2021 entry, because of all the grade changes throughout this year. So if you haven't been predicted to get 3 A's, we might still be able to consider you if you have a strong UCAT score. Again, go through the medicine info session. We don't take GCSE grades so we don't take GCSE grades into account except for English and maths, where you don't have an English or maths higher qualification like A levels or IB. So if you've got average grades at O levels, but you've superseded them with really good A level grades, that will be more important to us. At Bristol, we look at a variety of things for admission. So it'll be your A levels or equivalent. You need to have English language and numeracy skills, which we measure by your O levels or a higher qualification. You need to take a test called the UCAT, which is a standardized clinical admissions test for some UK universities. And that's the main thing we look at. And then to supplement all of that, you've got your personal statement, your work experience and the like. So hope that answers your questions. If you have got good A-level grades, then I'd recommend applying. If you're not certain that you're going to achieve the 3A levels, 3A's at A levels, it might not be the best place to apply to because we are quite academic at Bristol. And we have 20 places per year for international students. Okay, another question for Nikita. Nikita, how do you manage your time learning all of those scientific terms? Good question.
Oh, honestly, like the stuff that I just went through with you now, I know it seems like a lot because I just went over a semester's worth of information in an hour. But when you're actually learning through it, you go over it so many times. Like I said, you just unwillingly just memorize it. You don't even have to try. You just go over it so many times. And, seeing the cadavers first and second times is interesting and cool. But third times onwards, you're looking at the same thing over and over again. So it just helps just, hammer in whatever you need to learn and know. Apart from everything else, I would say, so coming back to the first question as well, actually, the way you are assessed in the UK is quite different from, say, Malaysia or anywhere in Asia. I know in Asia there's many more exams and quizzes and tests constantly, so you always have to keep up with it. But here as well, like your exams might be once a term or once a year. So you literally, if you feel like you're forgetting something, just go over it again once your exam season comes up. And that way you're managing time as well, and you're, memorizing these terms at the right time and strategically.
Hope that answers your questions. So we're almost at the end of our time. If there are no more questions, then maybe, Nikita, what I'll ask you to do is give some of these prospective medics any parting words of advice. Have you got any for them?
I would just say don't feel too pressured. I know it's a common idea that, going to medicine is suicide. You'll have no social life, you'll have nothing. But I'd say it's a very rewarding, you know, degree and a career. And UK actually is I would recommend UK because for international people as well, it's a good place to be in. And with the content wise, there's a lot in not just anatomy, but medicine itself. There's so much to, so much out there. But I've been told by lecturers as well, it's easy to just go down a rabbit hole because there's so much information. But if you strategize well and just learn what you need to know when you need to know, I think you'll be good to go. That's how you hack medicine.